Sometimes cash pricing beats insurance pricing, even when your insurance covers the medication. In this episode, I'm going to show you exactly how to stop overpaying for your prescriptions. Hello, this is Dr. Angela, and welcome to another episode of the Lifestyle MD podcast. This is another special soundbite episode where I'm going to talk to you about why your medication costs so much and what you can do about it. Have you ever gone to the pharmacy to pick up a prescription and been told, oh, that'll be $400? Or how about this one? Your insurance isn't covering that anymore. We're going to have to either get another prescription or a prior authorization. So all the while you're standing there thinking, I have insurance, my doctor prescribed it. Why is this so hard? And I have heard this kind of complaint or these kind of stories happening more frequently as insurance companies are facing tighter margins, as medication costs are going up. There are more and more denials, more and more requests for prior authorizations, more and more requests for formulary changes. So trust me, you are not alone in your frustration. I am frustrated and sometimes flat out angry that it is more complicated than it needs to be. So what I want to do today is pull back the curtain on a little bit of how medication pricing works, but more importantly, I want to give you some tools and strategies on how you can search for the best price and try to avoid getting overwhelmed by the nuance of it all. So the first thing I'm going to talk to you about is clearing up one big misunderstanding that I think a lot of people have. Just because you have insurance does not automatically mean that your insurance will cover the medication that your doctor thinks you need. I don't think that sounds as ridiculous as it used to, but at one point that just seemed absurd. It's just the reality. Healthcare does not work that way. Having insurance does not equal healthcare. Insurance companies create what's called a formulary, which is basically a list of preferred medications. And the decision about those preferred medications are based on contracts and pricing negotiations between the insurance company and a pharmacy benefits manager and drug manufacturers. So there's all these people in the background who are not interested in your care, who are not directly involved in taking care of you, who are making decisions about what is covered and what isn't. And also at what cost to you. This means that medication may be covered this month and not next year. One version of medication may be preferred while another one isn't. Your insurance may suddenly require you to switch brands partway through the year, or your doctor may recommend one medication, but insurance just prefers something entirely, even if it's in a totally different class, because they want you to go through step therapy first. And yes, heard me correctly, these changes can occur partway through the year. I've had a patient recently whose medication formulary changed 3 months into the calendar year. So I get feedback from patients, oh, the pharmacy said there was an issue with my script, or they reached out to you. First of all, they don't always reach out. It was actually not direct. They probably sent something through a prior authorization system that's got to make its way. So it's like 2 steps removed before it gets back to your doctor. And it's not usually a holdup on our end, it's a holdup on the insurance end. And that means that we have to then go on to an online portal, fill out some questions. Sometimes there are things that they want us to do that maybe we didn't exactly discuss in that appointment or maybe that year. So the process can be really convoluted. And here's the best part, is that insurance companies will sometimes change the rules on you. So just when your doctor thinks they've got it figured out, suddenly what they used to do no longer works. But here's an important disclaimer before I go on to the next step. Everything I share here today is meant to be general guidance, not universal medical or pharmacy advice. Okay, so medication pricing varies by state, pharmacy, insurance plan, drug manufacturer, and even controlled substance laws. And what works for one medication may not work for another. So think of today's episode as a toolkit for conversation that you can have with your primary care doctor or your pharmacist. And if you don't have a primary care doctor, I strongly encourage that you travel here with someone whom you trust. So here's the first strategy. Start with the manufacturer's website, especially for brand names. So if it's a newer or brand name medication, this is often going to be your best first stop. Some patients really don't tolerate generics, and that is often dismissed by some practitioners. It might be dismissed by the insurance companies. It might be dismissed by even the pharmacist. But if that's you, going directly to the manufacturer might be your best first stop. You can get savings cards. You can get help from a copay assistance program, temporary discount programs, or even direct cash pricing. There are some prescriptions that you can get directly from the manufacturer. For example, GLP-1s have recently come out with direct cash pricing. So you can purchase them through the manufacturer. You still need a prescription, but you can purchase it through the manufacturer. This is especially common for very expensive medications. So these are going to be rare medications, really expensive medications. Think GLP-1s, think tertiary or high-level migraine medications for people who have maybe failed the first step and second step of therapy. So the example I gave earlier about GLP-1s, Eli Lilly and Novo Nordisk have direct consumer pricing programs for some medications, and you can go there for that. I've personally used discount cards to get migraine medications and been able to pay $25 or less to get otherwise really expensive medication. Unfortunately, this does not apply to Medicare, likely not Medicaid, or any government-funded insurance program. So this is only for people who have commercial insurance. And again, importantly, you still have to have a doctor's prescription. This isn't about bypassing medical care. It's simply about getting another option to lower costs. Number 2, generic medications are still going to be your cheapest option. So if you can tolerate generic versions of medications, and many people can, this is usually going to be your best savings choice. If you can tolerate generics, you should be looking at places like Mark Cuban's Cost Plus Drugs. They offer a wide range of generic medications at cost, and arguably, I think maybe one of the least expensive options, the most transparent pricing that you can get for generic medications. You can also go to GoodRx or similar websites and get pricing, direct cash pricing, and get a coupon or use a GoodRx card to get a discount at the pharmacy itself. What I like about Cost Plus Drugs, the pricing is completely transparent. They show you what all the charges are, everything from the shipping. They all build in a little bit of markup. They offer home delivery, and it's even cheaper sometimes than what I can get prescriptions for. I give them to my patients, and I give my patients prescriptions at cost. And believe it or not, sometimes cash pricing beats insurance pricing, even if it's covered by your insurance with a copay. I've had patients pay way less without insurance than with using their insurance for some medication. So if you're not sure, you can always check their website, or you can go on GoodRx, any of those resources, and see what the medication will cost you if you paid cash for it. I'll include a list of places that you can check for cash pricing in the podcast notes. Strategy number 3, check with your direct primary care physician. This is something many people don't realize. Many direct primary care practices, depending on the state, including mine, can dispense medications directly or access medications through wholesale pharmacy partnerships. So if you have a direct primary care doctor, check to see if they dispense medications and if they're willing to look for at-cost pricing for you. Strategy number 4. I've already mentioned this or alluded to this, comparing pricing with discount programs like GoodRx. So never assume that every pharmacy charges the same amount when you're doing this. You'll notice this specifically when you use something like GoodRx. I reference GoodRx a lot because that's just the one that I use the most often. One pharmacy might charge $15 for a medication, another one might charge $45 for the exact same medication. So that's where these discount tools really come in handy, because you can actually price shop per pharmacy. So medication is not going to cost the same everywhere, which is the crazy thing, right? You would think that it would just be the same, but it's not. So GoodRx is one of the most popular options. Again, I'll list other options in the notes. But you can compare prices for local pharmacies. You can compare prices for the big box pharmacies like Walgreens, CVS, Costco, Meijer, Walmart, and in some cases, local pharmacies if you have it in your area. I strongly encourage that if you don't already use an independent pharmacy, I love independent pharmacies. It's like DPC for pharmacy. They're going to be super helpful, answer your questions, and they might have a little bit more bandwidth to help support you in navigating discount pricing. And speaking of pharmacies, don't be afraid to ask the pharmacist for the best cash price. You can say, hey, I'm willing to pay cash for this. Can you tell me what the best cash price is? And they can go in their computer, go wherever they go, and they can look up those programs for you and find discount options. And they might even have a better idea of being able to do it more efficiently than you. So I'm not saying you shouldn't do your own legwork first, but if you're not sure, ask your pharmacist. They can often help you navigate that. All right, strategy number 5, ask for a 90-day supply. A lot of my patients already figured this out. I would recommend using this if you are on a stable dose of a medication that you intend to use for 90 days or more. If you're in the process of titrating a medication or starting something new, 90 days may not be the best option, but getting a 90-day prescription and getting it through something like Express Scripts, if that's something that you're using with your insurance, is going to be the most cost-effective thing. So things like blood pressure medicines, cholesterol, diabetes medications, thyroid medications, anxiety and depression medications, great option. like stimulants for ADHD, certain anxiety medications, or pain medications follow much more strict federal and state rules. So patients cannot, usually with their insurance, get more than a 30-day supply. That's an insurance restriction. If you're paying cash, you can actually get a 90-day supply for ADHD medications, for example. So that's one little workaround if you want to have but laws will vary by state. So keep that in mind. You cannot shop around for controlled medications the same way you can shop around for non-controlled medications. Generally speaking, controlled medications are only going to be obtained from pharmacies that are able to are licensed to carry those things, and that's going to be your larger pharmacies, like your big box pharmacies or maybe your local pharmacy. Your DPC practice, Mark Cuban Cost Plus Drugs, you're not going to be getting controlled medications from those places. Having said that, you might still be able to pay cash pricing and get discounted cash pricing with discount cards from your local pharmacy. So don't overlook that option for your medications. And sometimes, as a little side note, if you are taking ADHD medication, a lot of insurance will only allow you to fill a 30-day supply. But if you're paying cash, you can often get a 90-day supply. You can't get refills, but you can get a 90-day supply if you pay cash for it. All right, final thought. Medication access shouldn't be this complicated, but it is. Hopefully, it's only temporary, but this is what it is right now. Until the system changes, the best things we can do is learn how to navigate it smarter. If a medication suddenly becomes more expensive, don't assume that you're stuck. Ask, is there a generic option? Is there a manufacturer coupon? Is there a cash price that is better than what my copay is? Compare pharmacies. All pharmacies don't charge the same price for medications. Can I get a 90-day supply of that, and will that save me money? And if in doubt and you've explored all those options, check with your doctor. Maybe your doctor knows something that you don't know about how to save on that medication. Sometimes a 5-minute conversation can save you hundreds of dollars. It is definitely worth it.